Welcome back to ABC-7 at 4. I'm Mark Ross. Well, September is both Childhood Cancer Awareness Month and Blood Cancer Awareness Month. And our medical contributor, Dr. Ogechika Alozie with Sunset West Health, joins me now with what you need to know. Dr. Alozie, how many children around the world are diagnosed with a blood cancer every year, or just a cancer in general?
Pediatric cancer specifically. So there's about 400,000 across the world, about 17 to 20,000 in the United States. It's unfortunately the #1 cause of death of children in the United States. And you know, it's one of those things that even though the treatments are much better and we're doing well and we're blessed locally to have a children's hospital and a host of pediatric oncologists, almost 100%, really 95% of them still have significant side effects when they get into middle age.
Now, what are the warning signs that parents need to watch for if they suspect their child might have cancer?
Well, I'll tell you this, first of all, parents don't get super worried and be anxious and over anxious checking all these things. But I think one of the things for me is bruising, right? Bleeding, all of a sudden losing a lot of weight, unexplained fatigue. If you have a kid that was running all over your house, busting down the doors, and he or she all of a sudden becomes unexplained lethargy and sleeping all the time, that's always a concern. Or headaches and a host of other things as well. That is a call to your pediatrician to have a conversation.
All right, let's turn our attention now to blood cancer. What are the three major types?
So the three major types are myeloma, lymphoma, and leukemia. And unfortunately, about every 3 minutes, someone in the United States is actually diagnosed with a blood cancer.
Talk for a moment about the estimated cases of those blood cancers.
So I know that this is blood cancer awareness and pediatric cancer awareness. This slide specifically tells you all comers. What's interesting is that in pediatric cancers below the age of 20, blood cancers account for about 25%. In adults, they're about 10%. And so you can see the difference is clear, obviously, because adults have more breast cancer, lung cancer, colon cancer, things that we've discussed in the past.
Now, what are the risk factors and causes of blood cancer?
You know, it's hard. A lot of it is genetics, right? A lot of times we talk about, is it nature versus nurture? And so genetics does make up a huge part, but your environment does as well. And I put environment with radiation, because smoking, the kind of job you have, asbestos, chemical pathogens that you take in. And just like we talked about with kids, even with adults, it's strange symptoms that weren't there. Prolonged fevers, when you know, I don't have a cold, I don't have pneumonia, what's going on? I've had this fever on and off for 30 days. Weird body aches and pains. And even though everybody wants to lose weight, you lose 20, 30 pounds in a month or two, that's a problem.
Not to mention chronic fatigue, too, which we talked about with children just a couple moments ago.
Exactly.
All right, lastly, plenty of resources here in El Paso to turn to for help when it comes to either blood cancers or childhood cancer.
Yeah, and we are really blessed. And so, you know, it's interesting looking back, the amount of controversy that the Children's Hospital went up with, but they have become a preeminent site for pediatric oncology, right? And so I think that's really important. But it's not just them. Texas Oncology does a great job. St. Jude's has a foundation here that works. Rio Grande Cancer Foundation, CBMC, and the Rio Grande Cancer Specialists. Across the board, there are resources to get identified, diagnosed, and treated for cancers, and I think that's immensely important.
ABC-7 medical contributor Dr. Ogechika Alozie, as always, thank you, sir.
Thank you.